I'm going to show an example for how to draw up and set up some meds. We have several different kinds of meds that we use. We have pills, like hard pills that you normally swallow. We have solutabs, they're supposed to dissolve in your mouth, and then we have powder packets, and then we also have that you mix with water, and then we also have just liquid meds. So I just want to give some examples of how I mix those up. We keep all of our syringes and meds in these little drawers. We have, for our pills, we set them up ahead of time where we throw a pill in an empty syringe. I'll show you why in a minute. We have like tip caps and little tiny syringes. We have these little spoons that we don't use for oral eating at all. We have some liquid meds that we've drawn up, so we just kind of organize her meds in here, and then we have empty, clean syringes, meds, just different ideas for how to organize things and tubes and whatnot in there. So once a day we go through and set up. Our daughter gets meds twice a day, so we set up an evening med and a morning med. So this is all of her meds that she's going to take tomorrow morning in the nice little Grange cup. And then these ones that she's going to get tonight, we have powder packs. She has pills that we'll draw water up into, and then this mixes water with the powder packs, and then this is just Benadryl, a liquid. So I'm going to set this over here. So if you have a powdered med that needs to mix with water, this is a specialty medication that tells you to mix water with it and then draw it up in a syringe. So these are little ketchup cups that we got at Walmart, but it fits really nice. It's just, probably holds just over an ounce, and we mix this with an ounce. I'm going to grab some water. So I draw up water, and when I draw it up, I'm not sure if you can see this, I draw up a little bit and then squirt it back to fill this up with water so you don't get air bubbles. And then I draw it back all the way, and I'm measuring out 10 ml 3 times, and then mix that just directly with the powder. I'm not sure how many, if there are many medications that are mixed this way. This one may be sort of unique, but I'm going to let that sit and dissolve. Then these are just pills, I don't know if you can see. They're just little oral tablets that you would normally just swallow with water. They're not meant to be like crushed or chewed because they taste nasty. But if you have hard pills like that, you can just draw up, put them in the empty syringe, and then you just draw up water in the syringe and then just leave them sit to dissolve for a few minutes. And this is a pretty common one. It's a Prevacid Solutab. And we also just put in there, put in the syringe, or put in the plunger, and then drop some water. And you can shake it up and let that dissolve. This is in my cup. Then, little spoons that we don't use for oral eating, we use to stir up this. And then we're going to draw up, in this case we draw up 25 ml, so there's 10, 25. And then the Benadryl I already have drawn up for liquid medication. I just draw it up and I put tip caps on it so that I just draw them up like maybe once a week or something. And then we also need a flush, so just water to flush the tube after we're done. So I have these 20 ml syringes that I like to use that for. Some people use 60s or whatever amount. And then we usually do meds with a 12-inch extension. Just hook it up to her. And when you hook it up to her, this is filled up with water. You don't want to do it empty or you'll put air in their tummy, but you just hook it up to their tummy, and then you're going to put the meds in the med port. You leave it clamped. You'll put the syringe in like this, unclamp it, push the med in, clamp it, and pull the syringe out. This is my hard tablet, so I'm making sure it's dissolving here. Then you just go through with all your meds and you do that. So you leave it clamped, you hook in the syringe, you unclamp it, you push in your med, you clamp it, and you remove the syringe. When you're all done, then you want to use water to flush to make sure all the medicine gets out of the tube and goes into your tummy. That's how we do meds.